Hi, my name is Phoenix, and welcome to our first episode for 2025 of Beyond the Couch. What is Beyond the Couch? Well, this is a play off the stereotype of couch therapy. Couch therapy started as a means of allowing a client to explore their own thoughts and feelings free from distractions in the room or even the therapist themselves. So the client would lie down, focus on the ceiling, and while sharing their deepest and darkest secrets. Now, we may have guests that share these same things, but this platform is also being utilized as a space that provides an opportunity for different guests to share stories, information, or not or knowledge based on their experiences. Today's discussion centers around a disease that affects an estimated 200 million women worldwide and approximately 1 in 7 women in the United States. Do you feel you know what this is? Well, before we get started, let me bring in our guest to introduce herself. Today we have Danielle McGregor.
Hi. Hi, everyone. I'm Danielle. I am an attorney and I work in the e-discovery, industry that's attached to the legal industry today. I am originally from the Caribbean, from Jamaica and Trinidad. I now live in the United States. I came here when I was a teen, 15 years old, actually, to be exact.
Thank you, Danielle. And thank you for being brave and joining my very first episode. Not my very first episode, but my first episode this year. So I appreciate you. So what do we think that this disease is? So we're looking at endometriosis, which I'm sure a lot of people are not really familiar with. So I'm going to give my sort of textbook knowledge of it. It's defined as a complex systemic disease associated with tissue similar to the endometrial lining of the uterus growing outside of the uterus that can affect the whole body. The whole body, which is the interesting thing, right? Because I think that of those people who have heard of it, they associated it as a sort of menstrual sort of function dysfunction. Okay. So the misconception is that it is not a menstruation disease. It is associated with hormonal disruptions. So estrogen can cause it to grow. And when it grows, it causes inflammation. Now, inflammation, as you know, affects all of your systems, especially your immune system. So then it causes an immune disruption. So you see how this can be a complication and a problem, not just a menstruation sort of deal, right? So this can lead to adhesions, scarring, internal bleeding, bowel and urinary dysfunction, constipation, painful intercourse, infertility. All of this physical pain can lead to psychological distress, which is where I come in, and found a study that 67% of the patients with endometriosis had been diagnosed with a mental health issue compared to 51.2% of those without it. Okay, so some of the factors, there's pain, fear of infertility, general uncertainty. All of these different things can contribute to mental stress as well, right? And there's a bi-directional relationship between the mental stress, your mental health, and also endometriosis, right? Because you can acquire depression and anxiety in having it. And in that, that causes an increased risk in developing the chronic pain, developing the chronic pain, and then it circles back again. So it can worsen both situations. Um, so this is like just the basic information so that you have an idea of what we're talking about and when Danielle shares her story. So I'm going to turn it over, Danielle, to you.
So like a lot of people out there, I never knew what endometriosis was, right? I had heard about it vaguely, like people mentioned I might have had that or I had it, and it's painful, right? That my periods are painful as a result of that. But for me, it started in 2020 when I guess the world was in a upheaval and especially in New York. Um, there was a lot of heightened stress, I guess, and anxiety due to COVID and us being essentially trapped in our apartments. Like everyone else, I decided that I should try to like keep a schedule, like work out so like my mental health is good. Get outside when I can to go for daily walks. During that time of working out, I started experiencing pelvic discomfort. I originally thought it was a UTI, right? That's normal. Like you feel that pressure, something is off. I reached out to my doctor and she put in a prescription for antibiotics for me, right? For the UTI. I took the antibiotics, the UTI sensation or the urge to urinate went away, right? So I was like, okay, this is fixed. Back to like my working out. I had my period that month and everything was fine. And then within like maybe 2 or 3 weeks, I had the sensation again. And this was after having had my period that month. Um, And I was like, what are the chances? Like, what am I doing that I'm getting these UTIs back to back? Right. Of course, I reached out to my doctor again and I explained the situation to her. She put me on antibiotics again. Um, but this time when I took the antibiotics, the pain never went away. Right. The sensation, the urge to urinate, and now added to it was the shooting knife-like pain in my pelvic area. Um, and it just felt like something was rubbing against my bladder, right? Never had a sensation before. And, talking to my sister and my mom, when you talk to other women to find out, like, is this normal? This doesn't feel normal. And they said no, they had never experienced that type of pain with a UTI before. So this time, and this is in the midst of COVID, I actually physically went into the doctor's office to now talk to them and find out like what's going on. I went into the doctor's office. They did a culture. They said the culture, the in-office test, it said the culture looked good. There didn't look like it was any bacteria, but they said I may still have an infection, so they're gonna give me a different type of antibiotic. So I was like, okay, I'll try to take this. Like you're always hopeful that once the medication the doctor prescribes you is gonna work, right? And so I take another set of antibiotics. So I'm taking this antibiotic and I finish it and there's no change, right? The pain is still there. The urge to urinate is still there. So I went into my doctor again now, my PCP, and she did a vaginal exam. But literally the touch of doing the exam was painful for me. So I couldn't, at that point, I felt like my bladder was on fire. When she pressed down below my belly button, it was just painful. And so she took some swabs and suggested that I go get an intravaginal exam and an ultrasound. So I went into the clinic or the imaging office and they did the exam. And part of these ultrasounds, if you've done them before, is that they make you drink tons of water. And for someone who's already experiencing the urge to use the bathroom to urinate, this was like torture for me to try to drink all this water because my bladder is just feeling so sensitive at this point. But I go through the process and finish my tests. And I reach back out to my PCP to ask her to let her know I'm finished and, await the results. And she explained to me how that it looked like I had maybe some vaginosis. And so she said, okay, I'm going to put you on some antibiotics. So now this is another round of antibiotics. I think maybe like the fourth round of antibiotics I had taken her. And this was within a month. And this is probably the second month. So I started taking that for the vaginosis, but my doctor, PCP, also said you need to go to see your OBGYN because there's obviously something else going on. She, I made the appointment with my OBGYN, and amazingly, my OBGYN had just opened back up for patients. Because at that time, you remember, unless it was like a real emergencies, doctors weren't seeing patients in the offices, right? So I made the appointment with the OBGYN, and I eventually get seen, I think like a week or two after. And I go in and I try to explain to the doctor, the OBGYN, the sensation. I gave her the whole history that I've just explained to you about all the antibiotics, the sensation, the pain. And so she does an exam, right? And she confers with some of the other doctors in the office, because I'm explaining that I'm having so much pain. She explains to me that she doesn't think that I have interstitial cystitis. And like other people, I had also started looking things up because at this point it was the second month and I'm still having pain down there and the urge to urinate. Antibiotics are not working, and I'm trying to figure out what is going on. So I had looked up this thing, the painful bladder, and interstitial cystitis is exactly that, painful bladder syndrome, right? With it is the urge to urinate and just pain in general in the bladder area. And this is a chronic illness. Never had any explanation as to what causes it, but there are a lot of recommendations online as to like what you can do to live with it. So it's like other things, there's no cure for that. So at that point, I was thinking, oh my gosh, I don't want to have interstitial cystitis. I don't want to live like this, in pain all the time. Right. And I went to, and then the OBGYN, she came back in the office and she said, I don't believe that you have interstitial cystitis. You are too young for it. I didn't know there was an age restriction to illness, but I guess there were studies, and the majority of women who had interstitial cystitis were older than me. So I guess that was her assessment of that. However, when we're going through all of the other things as to what could possibly be going on, she suggested that it could be caused because during her exam she thought she was looking doing the vaginal exam, and she said that it looks like I had cervicitis. So I already had vaginosis, and then I'm now her decision or opinion is that I have cervicitis. And to explain, cervicitis is just like inflammation, like that it's inflamed your cervix. And she's seeing it because she's saying that it's red and it's completely inflamed and she could see it. So she put me on another set of antibiotics. I think that makes it like what, a fifth set of antibiotics. And actually I went on two different types. One of them was doxycycline, and another one that I was put on.
At this point, how much into from the time that you had the pain until now, how much time are we looking at?
Probably like a month.
Okay, so now we're looking at a month. You're already on your fifth round of antibiotics. For people who don't understand, what sort of risk is that to have that many rounds of antibiotics at all?
I can't imagine it for me. I learned the potential effects after having been on all these antibiotics, that it can mess up your stomach, right? And for me, that's what happened. My esophagus is weakened, and so I have issues with reflux as a result of like my stomach being, having all this antibiotics in it. And of course, it kills bacteria in there, but then you have to feed it probiotics to keep your stomach from like, degrading too much. And I, the level of antibiotics I was on, I also took probiotics at the same time, but who knows if it was the right amount. There's no real dosage for like probiotics. But strangely enough, Phoenix, in that same time, I also was having pain in my teeth. It was so bad. I had to go into the doctor and they saw me during COVID. This is a very like just to explain how crazy it was. They saw me during COVID and I was in so much pain. And I had also gotten what I thought was like a sore or something in my mouth, but it could have been, and this is my assessment after the fact. You know, we were wearing masks when we went outside.
Yeah.
The stress of clenching,
Yeah.
right? And we thought something was wrong, so I was put on antibiotics for the potential infection that I had in my tooth, after seeing that sore. Um, so through that period, I took the antibiotics, I still have the pain. And so I went to an endodontist and he diagnosed me with TMJ issues and put me on a muscle relaxant. So like after all, so I'm adding antibiotics on top of antibiotics, antibiotics from the dentist, antibiotics from my PCP, antibiotics from my OBGYN, right? Of course, like anybody else, I mentioned, doctors always ask you, what are you on before you go in? So
Yeah.
they're aware of like what I'm taking at the same time. So after that first meeting with my OBGYN, and I got put on the two different types of antibiotics, I went home, hopeful that this is cervicitis. It's going to go away once I finish this round of antibiotics. I had a really bad reaction to the doxycycline. It wouldn't stay down. I would have to sit frozen in my seat in order for me not to throw it up, right? Because I want the medicine to work, so I want it to stay down. I'm just like, work, you're gonna stay down, right? And after like my family saw me sitting frozen in my seat, they asked me what's going on. I'm like, have to sit like this for 30 minutes until this goes down. And they told me that doesn't sound like it's supposed to be happening. But at that point, I wanted a cure to the pain. So I was gonna do what I was gonna do. And then after throwing it up a couple of times, I reached out to the doctor and she said, you're having a allergic reaction to the medication. So stop taking it. It's like, okay, but like what's gonna happen if I stop taking this? Like, isn't this part of like what you prescribed for me? Like, and she's like, it's fine. Continue taking the other antibiotic and come in and we'll talk. And this was like I had an appointment in like a week, I guess. So I went into the doctor and the second time she did the exam. She said the cervicitis looks like it's good, but like I'm still having the pain. So she's made a statement and she said, and this is something that my PCP had mentioned, but like I didn't know. She said, it may be your endometriosis. And at that point, I did not know I had endometriosis. But she mentioned it, and my response was, wait, I have endometriosis? And she's like, yeah. I was like, how do I not know this? That I have endometriosis. But at that point, I'm like, okay, because my PCP had also mentioned when she had been examining me after all those visits, if I had endometriosis. And I was like, I don't think I have endometriosis because I haven't. No one has ever told me I had endometriosis. And this whole time, my dad is the one who's taking me to all these doctor's appointments, driving to deserted Manhattan, to get to all these doctors and these hospitals.
But I feel like I hear you saying, and especially earlier, is the importance of community. So can you elaborate a little more on that, how important that is, and then where you were able to find that to help you through this process?
I know I said that endometriosis is like in every individual is different, but in the scope of understanding the type of pain and the sensations that you experience with endometriosis, I think that it's only could be found from someone else who has had endometriosis. Like my family is very supportive, right? They took me to all the doctors. They're there for me with all the like anxiety that I was having. But it was when I met up with like another endo sister. I met her in the hospital,
Hmm.
right? In the room next to me. And she and I stayed in contact as we were going through our recovery, that I explained like our lifestyle change, like the changes that we had to make in our lives, like stay away from plastics, no soy, cutting out red meat, some adapting to the endo diet, right? She was able to commiserate with me and actually like suggest places where you could find the grocery stuff that I was looking for, or the vitamin C that we were taking now, or the different things that are out there that only someone else with endometriosis will kind of understand how neurotic it can be, like looking for all of these things, or how neurotic you could be as you navigate this illness, right?
Hmm.
Because as a result of having endometriosis, I have developed a high threshold for pain. So when someone asked me, and my mom started asking me this when I first started having endometriosis, when someone asked me, "What's your level of pain?" I'm like, so 4 or 5, right? But so just imagine when I say it's a 6, right? Like when I say it's a 10, right? It's that much higher, right? And so
Hmm.
when I'm telling you that something is unbearable, it's unbearable. But somebody else with endometriosis who knows that like what it's like to go through that pain every day, like or have daily pain. So when I say that to my friend, she kind of understands like, oh my gosh, it must be really unbearable and can really commiserate. So, someone else who can kind of understand who has been there,
Hmm.
that level of comfort, I don't know. Like we live states away and we have a closeness about us. We check in with each other ever so often. We start sending each other Christmas cards and stuff,
Yeah.
right? And just being thankful for having that person, because yeah, you have these online groups, like Instagram groups or Facebook pages and those type of stuff. But there's nothing else that replaces like someone else you can pick up that phone and say, like, wow, I'm having a flare, right? And this is happening. And just to like let it out, that anxiety or that fear for someone, and the other person understanding completely and not judging, right? I don't think there's that anything else can replace that type of person, right? And
Hmm.
that type of community, right? Or if you're having a flare that just doesn't end, right? And you don't feel like it's ending, that's sort of like it'll pass, and understanding that they have come from that place too. They have experienced it, right? So it's that type of support. Yeah, I'm really grateful for that.
And yeah, along those same lines then, because I was reading in different places about the pain and about mixing that up with other things. So, I mean, how is someone supposed to know or differentiate from just menstrual cramps? Or because that was how it was starting when I'm reading different stories, that they thought they had cramps, or they, like you were saying, they had a really high threshold of pain. Are there indicators that maybe someone would investigate further into that in particular?
So one of the things that, and I mean, I know this is a generalization, they've said how that we grew up in this world where there are people who have painful periods, right? Pain comes with periods. Like we've learned that when we first started having our period,
Right.
it's like, that stigma, take a Midol, right? They have
Right.
so it's just take a Midol, you'll be good, right? So we grew up with this idea that like, hey, pain is normal for your period. Yeah, to a degree. So it's like the level of pain, right? Is the indicator, right? It should not be, you should not be having debilitating pain where you're like, I'm stuck in bed, I'm crawling on the floor sort of situation. So you should not be having debilitating period pain. And I mean debilitating, you shouldn't be crawling on the floor, right? To get to
Hmm.
the bathroom. right? One indicator for me, and I guess never really had an epiphany when it was going on in my teens, is that you should not be waking up to throw up on the first day of your period. Throwing up,
Mhm.
that should not be a thing, right? That was a sign that I probably had endometriosis from that time,
Wow.
right?
Hmm.
The throwing up sort of situation, the amount of pain medication that you need should not be to that degree. I always had this like envy of the girls who said, I really, you go through so much pain? And I used to say, dang, I wish I had that situation. But also as a woman, especially as a black woman, suck it up, go to work, right? But it was to that degree, it was debilitating, right? I had to crawl to the bathroom, like sit in the bathtub, in the shower hitting me with hot water, and then I had hot water bottles. And that's also the other thing. If you have to use a hot water bottle to that degree where you start seeing those scars, right? That is the sign that you probably have endometriosis. Because that pain, if you can go through the burn on your skin, right? And that heat, and you still don't feel any relief from the pain, yeah, that's not normal.
Yeah.
So like the throwing up, the level of pain. And there was something that people said, I don't know how scientific it is or if it's based on fact, but they said clotting. So clotting during your period, does your period clot a lot? They said
Hmm.
that's one of the indicators. I don't know how true that is, but that was something that I had lived. Like I used to explain it or describe it to my sister or my mom, and they're like, what? It's like, yeah, if you ever stood up and felt like the whole thing just dropped out, that's how it feels, like that clot. And if you're wearing a sanitary pad, it's just, that's done. That sanitary pad is done. That whole thing is just used up like that. You shouldn't be having those type of level of clots. I wish they would have said that. I wish I had known that back,
Yeah.
you know?
Well, and yeah, and that's brings us to really another important thing because we don't talk about these things enough. And so because we don't, these types of conversations aren't normalized and then people don't know what to look for. You know, you when we were going through earlier, you talked about a UTI, bacterial infection, vaginosis, painful bladder syndrome, cervicitis, appendicitis. You had all of these different diagnoses from like four, five, six different specialists, right? I read somewhere that it takes somewhere between 6 to 10 years to receive a proper diagnosis of endometriosis. 6 to 10 years,
Yeah.
and I feel like if you hadn't have been in as much pain as you had been in, you would have been, it could have just been an extended thing, not to mention how much it costs to have all of these specialists available to you, so healthcare, not having enough insurance,
Yep.
and a lot of people who are just dismissing your pain. You had multiple people who did that within your story, doing that, so then I think that making sure that we're having these conversations is really important. If you could see something that we could do as more of a preventative thing, as opposed to, okay, well, now I'm at this point and, it has done all these different things to my body. Do you feel like there's some sort of an education or something that we could receive early on and at a younger age?
But the funny situation is this. Right now, the only thing is surgery as the gold star of treatment, like excision surgery being the gold star of treatment. So even if you were to get a diagnosis young, what would be the treatment at that age? You know what I mean? Like, so unless we start getting health care coverage or insurance coverage for endometriosis for treatment, for like surgical treatments, knowing that that is the only treatment, like the top star that will give you some relief, until we start getting some sort of coverage, even partial, like it's sad or scary to say to someone younger, right? From the jump, you have endometriosis, right? That's not a diagnosis they want to hear because, like, to that degree, in those early stages, or what they did with my generation is that they said, the doctors kind of suspect it, right? I feel like they suspect it, but they don't mention it because that same idea, like, hey, the only treatment is surgery or we put you on this drug, right? That you could only take for 6 months. So like the options out there aren't so great. People can't afford it physically or even financially. So the first treatment that they have available is, hey, I'm gonna put you on birth control. It's the hormonal side, right?
Yeah.
So they give you these pills, and that's what they do for women who are younger. They say like if you can manage with the birth control will help keep the endometriosis in check. Whether that is true, a lot of women went through that first case because a lot of women who had painful periods, they prescribed them birth control. And we didn't realize it was a result of like, hey, we think you have this really bad disease
Hmm.
or illness, but we're gonna like prescribe this to you because like if your pain level stays in check or if you're with birth control, you're good, right? So like unfortunately, yeah, I even with my niece today, she tells me about her pain. Um, and she's like, oh, I took this and I bought her a hot water bottle for a Christmas gift, with like a cozy on there. And it has me a little wary about it. And give my recommendations. It's like, how many painkillers did you take today? Right. And she's like, I took this and I took that. It's like, make sure you're eating when you're taking those because your stomach, right? But like, I honestly don't want to tell her like something like that's not normal, like it's so scary
Hmm.
to have that sort of restriction or have that placed on you at such a young age. I wish it was something that we could prevent, but considering they don't know what the cause of it is, maybe it's all the stuff in our food, no one knows. So, in all honesty, not to say that I agree with them, but like to a level, like I understand the practice of, hey, let's if you're on this birth control, it might help you, right? In the long run, in like a short period of time. Because what are we gonna do? Like everybody having surgeries, that's gonna be hard. I hate to say it like that because it's like I know people who know they have endometriosis and they said, nope, surgery is not for me. It's just
Yeah.
a choice that they make. Yeah, they said it's not for me. I will live through the pain, you know? So it's definitely gonna be that, especially if we start diagnosing or if girls or doctors start informing women, right? Early on in their cycles, like in their like when they're getting their period and stuff, that this is a potential problem, that there's a potential that you do have this,
Hmm.
right? That like I mean, that's the only thing I would recommend, right? If that's what worked for me, because everything else wasn't working for me because I tried doing the endo diet prior to having the surgery. Yeah. And the endo diet is kind of a combination of the low carb,
Yeah.
right? To help with inflammation. And you're like praying, but like your body's already inflamed and this thing is feeding off of like potential estrogen in your body. So that didn't necessarily work with me without the surgery. After the surgery, eating that way has helped me prevent a lot of flare-ups, right? I have had minor flare-ups in between, right? But so like I mean, I guess that's the only thing I would recommend if outside of people having surgery is that like watch what you eat. It's not the exact cause, but it does help with the inflammation, right?
Yeah.
The inflammatory side of the disease. At least it helped for me. Some people it still never helped, right? But like I said, every case is different, and
Yeah.
just wouldn't wish this on anybody at a young age. Like I know this is probably controversial. The fact that I was able to live worry free for how many years, even though I had it, right? I'm pretty certain now that I had it from when I was a teenager, with all the throwing up and all the pain, the debilitating pain that I went through. Not really having that daily pain until like in my 30s, like my late 30s. I look back on the other happy times of not knowing, fondly. Yeah, I think that we need to let people know that they potentially have it, but we also have to let them know what the options are out there, right?
Yeah. And so if someone is wanting to obtain additional information, are there like a few resources or that you could recommend just off the top?
Well, I did a lot of Googling, but like the one resource, like I told you, I looked up Endo Black. That helped me a lot, like point me in the right direction. And
Hmm.
their FAQs explain like, and this is something in the industry that no one wants to give specific advice, like medical advice, but a lot of suggestions into doing your own research, right? In your own areas. But they will tell you the things that people have gone through, or like where, like they'll give you information as to where to look. I also found Nancy's Nook to be helpful for
Yeah.
me. They have a lot of information. Once you join the group, you like have to request admission to the group. And once you join the group, there's like a bunch of information in that group that you can read up on. They also have a list of surgeons nationwide that they recommend or people have gone to get treatment for endometriosis. So those are the two things that I use outside of abstractly doing like running my own Google searches, right?
Yeah. Okay. Um, well, and thank you for your time today. I think that one of the things though that it definitely like with the story and everything that we've been talking about truly highlights the lack of research and time that's given to a lot of these different areas, whether it be, especially when it relates to women's areas, whether it be like breast cancer and this type of thing in particular. I think to myself, we've had periods since the beginning of time.
Mhm. Yep.
We still don't have a way of figuring out whether or not someone has it aside from cutting them open. That makes zero sense to me. Um,
Right.
and
So
with all that we can do nowadays.
yeah. There's some research. A lot of people are doing research now, a lot more research going into it, and we've gotten more, I believe, federal funding,
Mhm.
research into endometriosis because, yeah, 1 in 7, right? So, and like you said, it can cause infertility sometimes, like not every single case, right? Or difficult pregnancies.
Mhm.
And there's always already such a high mortality rate when it comes to pregnant women in the United States, right? So just add the complication of already having like an underlying illness like endometriosis while being pregnant. Um, it just makes it that much more difficult. And so as people get concerned about the birth rate reducing,
Yeah,
I think it's important for us
right.
to look at all these factors that are reducing the fertility, right? Or the fertility options for women.
Well, thank you for your time. I really appreciate you sharing your story. What we'll do is if you have any questions for Danielle, please drop them in the comments and we'll be sure and get some answers for you on those as well. We appreciate you signing in and listening in, and we'll see you next time.